Good evening to everyone and welcome to today's session. I hope you are all bubbling with that enthusiasm. Psychiatry. There are totally 1500 flashcards. Every day around 50 to 100 flashcards we will discuss. And then in no time we will be conquering the subject of psychiatry. Those 7-8 questions that come in the tomorrow's NEET PG exam, you should be confidently answer after doing a revision of these 1500 flashcards in psychiatry. So let's start the great game. Good to see 8 online classmates. You can invite many more of your friends. So yes, every day evening, we have a live class, 1 to 2 hours, Chai Pe Charcha with Dr. Murali Bharadwaz. There are 427 hours of video available, totally 1500 video lectures on the online mbbs.com video library. That will give a complete focused revision of entire 19 subjects for the NEET PG exam. But videos are videos. A live teacher is live teacher. A live teacher is all that is required in order to give you that required push and energy for becoming a winner. Good to see Maggie and many more who are all online. So doctor, can online students can punch whether the voice is loud and clear for all of you? Yes. So let us take up today the topic of schizophrenia. In simple terms में बोलना है तो schizophrenia होता है पागल. So ये पागलपन का भी एक calculation है, and there is some favorite questions that come on schizophrenia. If there are 8 questions in psychiatry, one question invariably, any NEET PG exam ले लो, schizophrenia के बारे में, definitely you are going to get one question. So let us start the flashcard. Lifetime prevalence is what percentage? Incidence rate is how much per 1000? Flashcards are interesting way. एक फ्रंट में एक पॉइंट होता है which will question you. आप सोच रहे हैं मैं क्या गेस करूं इसका आंसर. टिंग इसको मारे तो it will turn and show you the answer. Then you can think, oh, I'm totally clean bowled, so let me bookmark this. So that way you can swipe just with your thumb. You can swipe the cards and can decide which cards you are completely clean bowled and can be able to bookmark them. And last moment before exam, you can only review the bookmarked flashcards. So on the Incus learning app, shortly, we are introducing this concept of flashcards. So doctor, the lifetime prevalence of the schizophrenia is 1%, whereas the point prevalence is 0.5 to 1%. And the incidence rate is 0.15 to 0.25 per 1000 is what you should remember. When do you call late onset schizophrenia? कितने साल के उम्र के बाद अगर पागल हो गया तो इसको बोलते हैं late onset schizophrenia. Anybody want to make a guess? Please punch your answer, doctor. Make it a interactive session. If the onset occurs after what age, you call it as a late onset schizophrenia. Come on, who is going to punch? If the onset occurs after the age of 45 years, it is called late onset schizophrenia. General population में, for example, medical college में In a batch, you will have around, say, 150, 200 students. How many will be schizophrenic? So you should know. In general population, it is 1%. Oh, Gurpreet Mahinder Singh has taught it as 30, but the correct answer, Gurpreet, don't forget 45 years. 45 years. Very good. So only when you are interacting, when you are challenging to make a guess, when you go wrong along with other classmates, then you will remember it forever. Okay? So, the non-twin sibling of a schizophrenic patient, 8%. Dizygotic twin of a schizophrenic patient, 12%. Monozygotic twin, 47%. Child with one parent with schizophrenia, 12%. And if both the parents are schizophrenic, they met in a schizophrenic group and then married and produced a child, he has a 40% chance of getting schizophrenia. That means there is a lot of genetic tendency. In lower socio-economic status, is there less prevalence or more prevalence? There is more prevalence of schizophrenia in the lower socio-economic states. अगर जेब में पैसे नहीं हैं, जेब खाली है तो पागल बनने का चांस बढ़ेगा. That's what you need to remember. There are 3 types of body. Asthenic, who are thin and weak. Athletic, who are muscular. Pycnic, who are short and fat. Short and fat. Which type are predisposed to schizophrenia? Which type to mania and depressive illness? So, the asthenic and athletic, they are predisposed to schizophrenia. Whereas the short and fat, pycnic, they are predisposed to maniac depressive illness, otherwise called bipolar disorder, is what you need to remember. Are there any chromosomes, any genes that you need to remember for schizophrenia? Yes, sir. 1Q, 5Q, 6P, 6Q, 8P, 10P, 13Q, 15Q, 22Q. They have the genes which can contribute to the schizophrenia. What are those candidate genes that contribute to schizophrenia? Nicotinic receptor gene, DISC1. It is disrupted in schizophrenia. Catechol-O-methyl transferase gene, neuroglin-1, glutamate receptor metabotropic gene, regulator of the G protein signaling RGS4, and D-amino acid oxidase activator. So this is how the various candidate genes contributing to the schizophrenia. Excess neurotransmitters, they are implicated in the pathogenesis of schizophrenia. What are they? Schizophrenia में 2 concepts हैं. One is called one is called the dopamine hypothesis. Other is called as serotonin hypothesis. So why do we get schizophrenia? अगर dopaminergic activity बढ़ गए, then हम पागल बन जाते. So that is one reason, right? So that is one reason. Then serotonin, excess serotonin is also responsible for the symptoms of schizophrenia. is what you need to remember. A 28-year-old male graduate student without any prior medical or psychiatric history. His mother brought him. She says that he is very anxious in the past 12 months. He has an increasing concern that the people are watching him. He now claims to hear the voices telling him what must be done to assassinate the president. What is your diagnosis? So you should remember schizophrenia, classical presentation. Tell me the list of all the positive symptoms of schizophrenia. Hallucinations, delusions, bizarre behavior, disorganized speech. All these positive symptoms, please don't forget. 1. Hallucinations. 2. Delusions. 3. Bizarre behavior. 4. Disorganized speech. Please don't forget. If you give antipsychotic medications, they are most likely to respond. So one simple way to remember is normal behavior added things will make them positive symptoms. That's what easy way to remember. Now the next question. Next flashcard. Negative symptoms of schizophrenia. A flat and a blunted affect, anhedonia, apathy, alogia, lack of interest in socialization, and they are very resistant to treat. And they are all contributory to lead to the social isolation of the patient. So the cognitive symptoms are also there. Positive symptoms, negative symptoms, cognitive symptoms. Impairment in attention, executive function, working memory. And they are responsible for the poor work and school performance is what you need to remember. Very good point. Gurupreet Mahinder. A. Anhedonia. A. Affect. A. Apathy. A. Alogia. They're all negative symptoms. All A's are negative. Beautiful. So keep punching into the chat window some good mnemonics that you remember. Easy way to remember. So once these flashcards come into our Incus learning app, you can also add an audio, video, text, image-based comments under every card, under every flashcard. That way it becomes like a collective preparation of everybody. Right? So, what are examples of catatonia which are seen in schizophrenic patients? Stereotyped movement, bizarre posturing, muscle rigidity. They're all the examples of catatonia in schizophrenic patients. Stereotypical movements, bizarre posturing. Just like some of our classmates will sit in reading room. They will be reading, not even moving the neck or head. You should think maybe this is a catatonic schizophrenic fellow. Bizarre posturing, muscle rigidity. They're all the examples of catatonia. What are the prodromal symptoms? Prodrome is like a drizzle of rain before a storm is coming. So there's a decline in functioning that precedes the first psychotic episode. A psychotic patient becomes socially withdrawn, he becomes irritable, he will have physical complaints of declining schoolwork performance. Suddenly he gets a religious belief, etc., etc. They're all called prodromal symptoms. What are the psychotic symptoms of schizophrenia? Perceptual disturbances, delusions, and a disordered thought process, thought content, that defines the psychotic features of the schizophrenia. What are the residual symptoms of schizophrenia? So all these definitions are important now, because ultimately examiner is going to play with you on these few funda in psychiatry. After an acute episode of active psychosis, following that, residual symptoms occur. So there will be mild hallucinations or delusions, social withdrawal, and negative symptoms. They can occur after an acute psychotic episode, which are called residual symptoms. Why do you want to give clozapine only when the patient fails both the typical and also atypical antipsychotics? What is the reason for that? Clozapine is very effective. Even for a resistant case of the schizophrenia, it is effective. But the problem is agranulocytosis is a serious adverse effect of clozapine. Suddenly, WBC count will fall down. That's the reason absolute neutrophil count, WBC count, you need to keep monitoring closely in a patient who is on clozapine. That is the reason, as a last resort, you want to use the clozapine. What are the DSM-5 criteria that must be present for at least 1 month? 1 month. Please don't forget. If you want to make a diagnosis of schizophrenia, so you should know the list. DSM-5 criteria list. Proper malumuna. Delusions, hallucinations, disorganized speech, catatonic behavior, which is grossly disorganized. Negative symptoms. 2 or more of this, especially delusion, hallucination, disorganized speech. At least one of these. 2 are for at least 1 month. Not only that, it should cause a significant social, occupational, self-care, functional deterioration. And it is not some other medical condition or a substance abuse responsible for this. That you have to be very sure about. Before you diagnose schizophrenia, what should be the duration of illness? At least kitne mahine rehna hai? For how many months? It should be there for at least 6 months. 6 months. For you to label the diagnosis as schizophrenia. Please don't forget. यहाँ 6 months का मामला है. इसके पहले वाला क्वेश्चन में DSM-5 criteria at least 1 month. That's the point. What are the 5 A's of schizophrenia? Very good. अभी आ गया गुरप्रीत महेंद्र सिंह का negative symptom list of 5 A's. A. Anhedonia. A. Flat affect. A. Elogia, which is poverty of speech. A. Ebullition, that is apathy. A. Attention, which is poor. The 5 A's of schizophrenia, which are negative symptoms. What are the 8 typical findings in schizophrenic patients? They have very disheveled appearance. Appearance, they don't shave, they don't clean themselves, they're wearing all dirty clothes. So disheveled appearance, flat affect, disorganized thought. But their procedural memory and orientation are intact. Please don't forget. They have auditory hallucinations, paranoid delusions, ideas of reference, lack of insight. They are the typical findings of the schizophrenic patient. What is the definition for you to call brief psychotic disorder. A brief psychotic disorder lasts less than 1 month. Schizophreniform disorder, it will last between 1 to 6 months. And beyond the 6 months, then you call schizophrenia. समझ में आ गया ना? Favorite question of examiner. अच्छा, अभी एक लंबा स्टोरी शुरू हो गया. Raju, 23-year-old man, brought by his mother after he started talking about aliens. He says, "Oh my God, aliens from the Mars are trying to steal my soul." Raju reports that aliens left messages for him by arranging sticks outside his home and sometimes sent thoughts into his mind, thought insertion. He is guarded and often stops talking while in the middle of expressing a thought. That's called thought block. He appears anxious, frequently scans the rooms for the aliens, and when he thinks that they have followed him to the hospital, and he says that sometimes, "Oh my God, these aliens are planning to throw me under the lorry," he says. And the patient's mother reports that all this he started only a few months ago, but they have become more severe in the last few weeks. And she says that during the last year, he has become isolated from his peers, frequently talks to himself, and he has stopped going to college. And he is browsing the internet in order to find how to create devices that will prevent aliens from hurting him. So many things. The illness of the mind is not that easy to suffer, that easy to treat. And even the father of the parent of this Raju, he suffered from schizophrenia. So what is your diagnosis? Schizophrenia. So what do you find in this? He exhibits delusional ideas that are bizarre and paranoid. He has auditory hallucinations, disturbances in the thought process like thought blocking. And he has a social occupational dysfunction. He stopped going to school. His father also had that. So that is how you reach the conclusion. Now, which season, if the people are born, they have a higher incidence of schizophrenia? We still used to use this fact in psychiatry book in the MBBS days to throw a joke on our classmates born in November, December. So people born in late winter, early spring, they have a higher incidence of schizophrenia for unknown reasons. Now, what are the differences between men and women when it comes to the presentation and outcome of schizophrenia? Men and women are equally affected. Pagal, pagali. Lion, lioness. So men and women are equally affected, but they have different presentations and outcomes. Men tend to become schizophrenic early in mid-20s. Women present in late 20s. Men will tend to have more negative symptoms and a poorer outcome and resistance to treatment compared to the women is what you need to remember. Schizophrenia is very rare before what age or after what age? Typically before age 15 or after age 55. Schizophrenia rarely presents. What is the proof that there is a strong genetic predisposition to schizophrenia? How do you say? Among the monozygotic twins, there is a 50% concordance. If both the parents have schizophrenia, chances of the kid getting is 40%. If there is a first degree relative, then there is a 12% risk of developing schizophrenia. What is the most commonly abused substance among the schizophrenic patients? Schizophrenic patients have a more tendency to abuse. So, nicotine, more than 50%, followed by alcohol, cannabis, and cocaine. What is post-psychotic depression? Typically, in schizophrenic patients, you see this phenomena where they develop a major depressive episode after the resolution of their psychotic symptoms. What is downward drift hypothesis? Drift hypothesis in schizophrenia. The lower socio-economic groups have a higher rate of schizophrenia. Why? Because people who have schizophrenia will not be able to function socially well. So they end up in lower socio-economic groups. And many homeless people in urban areas suffer from schizophrenia. अगर हम मुंबई गए, दिल्ली गए, रोड के ऊपर रहते हैं schizophrenic, lower socio-economic people. What is the substance of abuse that increase the dopamine activity and can cause schizophrenic-like symptoms? Cocaine and amphetamine, they increase the dopamine activity and typically lead to schizophrenic-like symptoms is what you need to remember. Inadequate dopaminergic activity. In which part of the brain lead to negative symptoms of schizophrenia? So in the prefrontal, in the brain, in the prefrontal area, cortical area, a decreased dopaminergic activity is responsible for all the negative symptoms of the schizophrenia is what you should remember. Excessive dopaminergic activity in which part of the brain leads to positive symptoms of schizophrenia? Typically in the mesolimbic area, excessive dopaminergic activity leads to positive symptoms. An unpleasant subjective sense of restlessness and an urge to move, manifesting as the inability to sit still. What is this called as? What is the term for that? Akathisia. Akathisia होता है unpleasant subjective sense of restlessness, need to move, manifested by inability to sit still. The blockage of the tuberoinfundibular system by the antipsychotics. What does it lead to? Typically, if you look at the pituitary gland, you have a anterior pituitary, posterior pituitary. So the tuberoinfundibular blockade will cause hyperprolactinemia. Normally, dopamine inhibits prolactin. And that leads to development of gynecomastia, galactoria, sexual dysfunction, menstrual irregularities, etc. Whenever the person is taking antipsychotics and which are basically anti-dopaminergic. The blockade of nigrostriatal system by the antipsychotics, what does it lead to? All these Parkinsonism-like clinical features, extrapyramidal side effects, tremor, rigidity, slurred speech, akathisia, dystonia, they're all because of the nigrostriatal blockade caused by the antipsychotics, which are anti-dopaminergic. Risperidone and clozapine, they are used in schizophrenia. They are atypical antipsychotics. What is the neurotransmitter that they antagonize? So one of the theory behind the psychosis and schizophrenia is increased serotonin. So some of the second generation atypical antipsychotics like risperidone, clozapine, they all antagonize the serotonin. That is the reason they are used as antipsychotics. Now, one of the very important biochemical basis for schizophrenia is a decreased expression of an enzyme which is required to create GABA in the hippocampus, which is the part of our limbic system which controls our emotions. So the decreased expression of this enzyme necessary to create the GABA in hippocampus of the schizophrenic patients. Why the ketamine causes psychotic symptoms? So typically, the schizophrenic patients have fewer NMDA receptors. NMDA क्या होता है? N-methyl D-aspartate. So fewer NMDA receptors are associated with schizophrenia. Even ketamine is an NMDA antagonist. That's the reason those who are being administered ketamine will develop a emergence delirium, is what you should remember. The long-term use of the antipsychotics. What is the effect of it on noradrenergic neurons? So one of the theories says elevated norepinephrine is implicated in the causation of schizophrenia. So that is the reason long-term use of antipsychotics is known to decrease the activity of the noradrenergic neurons, is what you need to remember. This is a very interesting question. If one identical twin has schizophrenia, what is the risk of the other identical twin having schizophrenia? It is 50%. 50%. Now, what are the various CT and MRI findings in the brain if you take a schizophrenic brain? There is an enlargement of ventricles, there is a diffuse cortical atrophy, and there is a reduced brain volume in the patients who are having schizophrenia. Now, what is the prognosis in schizophrenia? Even if you give medication, 40 to 60% of patients, they become impaired significantly. Only 20 to 30% can function fairly well in society. About 1/5 of the schizophrenic patients attempt suicide, and many more experience the suicidal ideation. So that is the challenge of schizophrenia. Now, factors with good prognosis, factors with bad prognosis in schizophrenia. This is one of the most favorite multiple choice question in the NEET PG exam. You have to be 100% sure. A late onset after 45 years. आप प्रोफेसर बनने के बाद पागल हुए तो बेटर है than being a pagal when you are a medico. A good social support, good prognosis, positive symptoms, mood symptoms, acute onset, females, few relapses, good pre-morbid functioning, better prognosis. What lead to a poorer prognosis? Early onset, poor social support, negative symptoms, family history, gradual onset, males, many relapses, poor pre-morbid condition, and a comorbid substance abuse. They're all worse prognosis. First generation antipsychotics. What are examples? Chlorpromazine, flufenazine, haloperidol, Perfenazine, they're all first generation. What are second generation? Arpiprazole, Esinapin, Clozapine, Iloperidone, Lurasidone, Olanzapine, Quetiapine, Risperidone, Ziprasidone, they're all considered to be second generation. Now, what are the side effects of the first generation antipsychotics? All first generation antipsychotics are antidopaminergic. That's the reason they will have extrapyramidal symptoms, neuroleptic malignant syndrome, tardive dyskinesia. They're all the problems with non-selective antidopaminergic antipsychotics, which are called as the first generation. So where do you use first generation antipsychotics? They are primarily dopamine, mostly D2 antagonists. They treat positive symptoms very effectively, but they have a very minimal impact on the negative symptoms, is what you should remember. Second generation antipsychotic medications, how do they function? They antagonize the serotonin receptors and also dopamine. In the dopamine also D4 more than D2. D2 is for movement, D4 is for the mind. Easy to remember. D2 is for movement. You require dopamine for movement. D4 is for the mind. All psychosis is due to excess D4. If you use the first generation, instead of affecting D4 selectively, it also affects D2. That is the reason all these movement disorders are the side effects. Tardive dyskinesia, echinacea, rigidity, Parkinson-like symptoms with the first generation antipsychotics. How does first and second generation differ? Typically, they don't differ much in efficacy. Both are efficacious. They differ in their toxicity profile. So, extrapyramidal side effects, they are lower with second generation antipsychotics, unlike first generation. But second generation antipsychotics, they increase the risk of metabolic syndrome, is what you need to remember. Second generation antipsychotics, for how long they should be taken, at least how many weeks before their efficacy is decided? At least for 4 weeks they should be taken. Now, what is the drug? Wow, Rachit Sharma. Good to see you. I'm one of your old students, 201617. I have completed my MD Psychiatry with flying colors. Excellent, doctor. So Rachit Sharma, now I don't mind if I get a late onset schizophrenia, because now I'm 47. So after 45, we call late onset schizophrenia. So I hope you will give me a free consultation now as a Guru Dakshina, right? Very good. I'm so happy. So Rachit, if you like to contribute some MCQs, or if you want to counsel some of the students who are passing through the stress of the NEET PG, you being a great psychiatrist among our students, please volunteer, and we would be really grateful, right? Now, good to see and to receive that acknowledgement from you. Now, doctor, which drug in antipsychotics is reserved for the patient who has failed multiple antipsychotic trials? you will reserve it. You don't use it that often because of the risk of a granulocytosis, clozapine. So when you use antipsychotics, because of their anti-dopaminergic activity on the D2 receptor, there are extrapyramidal symptoms. How do you treat them? So what are the extrapyramidal symptoms? Dystonias of the face, neck, tongue, Parkinsonism, resting tremor, rigidity, bradykinesia, akathisia, the feeling of restlessness, any of them can occur. So we use benzotropine, diphenhydramine, Avil, anticholinergics, benzodiazepines, beta blockers, especially for akathisia. Low potency first generation antipsychotics and the atypical antipsychotics. What will they lead to? They lead to a plethora of anticholinergic symptoms. So dry mouth, constipation, blurred vision, hyperthermia, they're all the anticholinergic symptoms. And you need to treat it. Eye drops, stool softeners, etc. for all those anticholinergic symptoms caused by the low potency first generation antipsychotics and atypical antipsychotics. What are the second generation antipsychotics? If you want to avoid metabolic syndrome, atypical antipsychotics are known to increase the risk of metabolic syndrome. So what are the weight neutral second generation antipsychotics that are useful? Especially you want to avoid metabolic syndrome. Arpiprazole, ziprasidone. These are the two things you should remember. They are considered to be weight neutral second generation antipsychotics is what you should remember. Tardive dyskinesia is caused by the first generation antipsychotics. How do you want to treat this tardive dyskinesia? We give vitamin E, Botox, benzodiazepines to treat the tardive dyskinesia. Then there can be change in mental status, autonomic instability, lead pipe rigidity, elevated CPK levels, leukocytosis, metabolic acidosis. This symptom complex, high fever, labile blood pressure, tachycardia, tachypnea, diaphoresis, lead pipe rigidity, which is extrapyramidal, elevated CPK, significantly elevated CPK, leukocytosis. A lot of times they will be diagnosed as a fever. So what is this called as? It's called neuroleptic malignant syndrome, which is typically caused by the high potency first generation antipsychotics. So what are the important ECG changes that are caused by the antipsychotics? Prolonged QTC interval, corrected QT value. Normally it is less than 0.4 seconds. More than 0.6 seconds is called prolonged QT. That can occur. Now you are able to see this important change in the retina. What are you able to see? Pigmentary changes. इसको बोलते हैं pigmentary retinopathy. Which antipsychotic will lead to that? Thioridazine can cause an irreversible retinal pigmentation on high doses is what you should remember. Now you are able to see the change in the lens. You are able to see some deposits in the cornea. Not in the lens, but in cornea. So deposits in lens and cornea they can very much occur with chlorpromazine is what you should remember. So that brings us to the end of today's Chai Pe Chircha with Dr. Murali Bharadwaj. So, mere pyare sathiyon, I like to once more tell all of you that every day evening, हम सब मिलेंगे, साथ में पढ़ाई करेंगे, and we will be inspired to read. So, Incus Learning app in the Google Play Store, you can download the Incus. We have quiz tournaments, flashcards, video lectures. We have live online courses, everything available. Thank you, Maggie, as usual, for your good compliment of wonderful session. So, Doctor, before I bid a farewell to all of you, I want to once more tell you that onlinembbs.com, please don't forget, we have released the 2022 edition HD videos, 427 hours of HD videos, 10,000 PowerPoint slides, notes of the focused NEET PG self-preparation. So once you come here, you have this available. So once you click, there is a PDF. What are the 1500 lectures focused way you need to do the revision in 427 hours. So in medicine, there are 169 lectures, 39 hours. Pharmacology, there are nearly about 140 lectures, 50 hours. Obstetrics, gynecology, there are about 145 lectures, 45 hours. So you have all of them available. So there is something called preview. You click on preview, you can even have a sample of the lecture. Of course, Dr. Murali Bharadwaj does not need a sample because I am abundantly available on the internet. So following every video, there is a PowerPoint. You can happily be able to do a review of whatever the PowerPoint slides used in the lecture. So I invite all of you to say that please go to onlinembbs.com and then do the revision of this 427 hours. रोज आप एक 3-4 घंटे revision कर लो, and our videos are all very short videos, like 10 minutes, 20 minutes, 30 minutes, 7 minutes, like that. And if you want the list of those videos, please call our helpline. So they'll be more than happy to assist you with all the list of the lectures, how they are 427 hours topic wise. So please inform your friends also and call our helpline 9000868356, and they will be more than happy to give you group discounts in order to get this content of 427 hours of video lectures. So it is not just the lectures. I want to tell all of you, it is not the lectures, the revision sessions. In fact, all these revision sessions are this kind of chai pe chircha sessions only, right? After our class is over, we will archive this video into the online video library. Every day you should prepare. You should be inspired to prepare. For that, you don't need some 5-star rated teachers or some celebrity teachers का जरूरत नहीं है. आपका रूममेट, आपका रीडिंग रूममेट, आपका स्टडी मेट, 1-2 साथी रहना है आपके साथ, जिसके साथ आप फ्लैश कार्ड स्टाइल में शेयर कर सकते क्वेश्चंस पूछो, वो जवाब देगा, वो क्वेश्चंस पूछेगा, आप जवाब दे दो, और पूरा 1000 टॉपिक्स रहता है मैक्सिमम, एंड there are not more than 10,000 to 20,000 points that you need to revise. You can take it granted. Dr. Murali Bharadwaz, past 22 years, had been a classmate to many people who topped the entrance exams. And sometimes students ask me a question, Sir, आप ही पूरा 19 subjects revision करते हो? हाँ. Because you are the only student who is reading 19 subjects, I should be the only teacher who explain you the 19 subjects and do a revision along with you like a classmate. So every day मिलेंगे और मिलके पढ़ाई करेंगे. Don't forget to subscribe to onlineMBBS.com video library. Good night and see you all tomorrow.